This is part 6, and it's entitled FDA Final Rule Electronic Submissions. So when you have to go through either the PMTA process, the pre-market tobacco market application process, or the substantial equivalence process, or the pre-market substantial equivalence process, and even on the registration of certain products that are in a vape shop, they have to do all the product listings and e-liquids that they have in vape shops. They have to register by the end of the year, by the end of 2016. And then also certification as far as if you have zero nicotine levels, you still have to submit a certification to the FDA, because there may be derivatives. Supposedly, as far as the FDA is concerned, there might be still some derivatives in that 0 mg nicotine. So you have to, it's not too complicated of a process, but still you have to prove to the FDA through the certification process that the nicotine level is actually 0 mg. So the first thing I'm going to speak to is it's called costs, and this comes right out of the FDA final rule. It's 29078 Federal Register. This particular part also will be this part 6 will also be quite long. I might do a subpart, I don't know. So anyway, here we go. Costs, 29078 Federal Register. The primary estimate for the present value of total quantified costs over 20 years is approximately $988 million at a 3% discount rate and $817 million at a 7% discount rate. The quantified cost of the final rule can also be expressed as annualized values, as shown in Table 1. Unquantified costs, which may be attributable to this final rule, include some consumer costs for users of the newly deemed products due to loss of product variety or higher prices, record-keeping costs for exporters of deemed tobacco products, compliance costs for components and parts other than complete ends delivery systems, the cost of testing and reporting for HPHCs, the cost of any clinical testing that may potentially be conducted to support SC reports, market adjustment friction costs, lost producer surplus associated with product consolidation, exit of manufacturers, and the switch to pure retailing among retailers such as vape shops who currently engage in manufacturing activities. FDA has concluded that the benefits of the final rule justify the costs. In addition to the social costs described in this document, the final rule would lead to distributional effects, such as reduced revenues for firms in affected sectors, payment of user fees, and potential changes in tax revenues. Excuse me. After this initial compliance policy period, we expect that most vape shops will continue to operate, but those that have not already switched pure retailing will likely to do so. So here they go. This is pretty much, as far as the costs are concerned, what they have to submit to the FDA. This is just part of it. I'll get into the other areas as well. And like it says the FDA concluded that the benefits of the final rule justify the cost. And I spoke about that in the other part, which was part 5 with the FDA executive orders. And definitely the costs do not justify this particular FDA final rule at all. It's way, way too much. I mean, look at that. It's $988 million over a 20-year period of time. And if the FDA final rule remains in place over 20 years without legislation or litigation changing that FDA final rule in any way, I'm sure that $988 million is going to be much lower because well, there won't be many people submitting applications to the FDA. So that's one part. Next part is civil penalties. This is also quoted, all this is all quoted from the FDA final rule. This is all cross-referencing and things of that nature. So this is Civil Penalties, Tobacco Control Act, Section 103, conforming and other amendments to general provisions. 9 civil monetary penalties for violation of tobacco product requirements. A, in general, subject to subparagraph B, any person who violates a requirement of this act which relates to tobacco products shall be liable to the United States for a civil penalty in an amount not to exceed $15,000 for each such violation and not to exceed $1 million for all such violations adjudicated in a single proceeding. B, enhanced penalties. 1. Any person who intentionally violates a requirement of Section 9025, 9026, 904, 908C, or 911A shall be subject to a civil monetary penalty of 1. Not to exceed $250,000 per violation, and not to exceed $1 million for all such violations adjudicated in a single proceeding. Or 2, in the case of a violation that continues after the Secretary provides written notice to such person, $250,000 for the first 30-day period or any portion thereof, that the person continues to be in violation, and such amount shall double for every 30-day period thereafter that the violation continues, not to exceed $1 million for any 30-day period, and not to exceed $10 million for all such violations adjudicated in a single proceeding. 2. Any person who violates a requirement of Section 911G2C2 or 911I1 shall be subject to a civil monetary penalty of 1. Not to exceed $250,000 per violation, and not to exceed $1 million for all such violations adjudicated in a single proceeding. Or 2, in the case of a violation that continues after the Secretary provides written notice to such person, $250,000 for the first 30-day period or any portion thereof, that the person continues to be in violation, and such amount shall double for every 30-day period thereafter that the violation continues, not to exceed $1 million for any 30-day period, and not to exceed $10 million for all such violations adjudicated in a single proceeding. 3. In determining the amount of a civil penalty under Clause I-2 or II-2, the Secretary shall take into consideration whether the person is making efforts toward correcting the violation of the requirements of the section for which such person is subject to such civil penalty. So, put that in the context of the vaping industry. Let's say a vape shop owner decides after May 11th, 2019, to continue to mix their own e-liquids and sell that to the public. So they first can get the first penalty is $15,000 right off the bat. That's the penalty for violating the FDA final rule. So let's say they sell one e-liquid to a customer which was not approved by the FDA. That's a $15,000 penalty. Now, let's say they're penalized, but the vape shop owner can still remain in business, and then decides to sell another e-liquid that they mixed on their own to another customer, and the FDA finds that out. Well, then it's a $250,000 penalty. I mean, that is a serious amount, and this is per violation. So if they're caught selling 10 e-liquids to 10 customers, that is what? That's $2.5 million penalty. Now, if it's, let's say, for instance, if they wind up being brought into a court of law, United States District Court level, because it'll be in a federal court. Let's say the FDA takes this vape shop owner into a court of law, and the vape shop owner loses. Then that vape shop owner has to, for that single proceeding, for that one court case, will have to pay $10 million as a penalty. That is some serious money. Which, that $10 million will literally, what the FDA is basically saying, we will put you out of business. You will be out of business. Because if they can't pay the $10 million right off the bat, then what happens is the FDA will actually put a lien on that vape shop and literally put him out of business. Yeah, unless he goes into bankruptcy, and still he'll be out of business anyway. So this is some serious situations after May 11th, 2019, after that 36-month time frame. So anywhere from 15,000, and if that same vape shop owner continues to sell e-liquid or whatever it could be a tank, could be a box mod, could be anything, even a drip tip, just a drip tip. Because it's the intended use of a drip tip. The intended use to use a drip tip is with, when you put a drip tip, you just don't buy a drip tip unless maybe you're a collector of drip tips, you never use them with your vaping products. But you buy a drip tip, you're going to use it on your tank or a DA or whatever. He can be fined right off the bat $15,000 for that violation if he didn't get that drip tip. Now, that is if he manufactures the drip tip. Now, there are some vape shops or some people out there that actually do, like the Trinity, a perfect example. This is a perfect example. Like the Trinity drip tips, right? They're really nice, really nice. They're like $25 a pop, okay? They exclusively, they do other stuff, but they mainly do drip tips. Right, really nice drip tips, by the way, okay? And let's say, because they manufacture their own drip tips, then they can also be penalized as well, from $15,000 all the way up to $10 million. Now, a vape shop owner sells a drip tip, he probably won't get into trouble because he didn't manufacture that particular drip tip. But as far as a vape shop owner is concerned, if he makes his own e-liquid, or if he makes a drip tip, or anything of that matter, and sells it without having approval from the FDA, then he initially gets penalized $15,000, and then it can actually grow and grow and grow till they actually take him to court, where he can actually get penalized for $10 million, which is basically means he's going out of business. So that's the penalties as far as violating the FDA final rule. Now, the next part is foreign importers. And we'll get to electronic submissions in a moment, but I want to just sort of give this as a backdrop as to why you ought to submit these electronic submissions, because if not, you'll be not in compliance with the FDA final rule, and you get in serious trouble. Foreign importers. With the passage of the Tobacco Control Act, Section 801 of the Food, Drug, and Cosmetic Act, 21 United States Code 381, was amended to add tobacco products to the inventory of FDA-regulated products. The revised Section 801 charges the Secretary of Health and Human Services, through FDA, with the responsibility of assuring that foreign origin FDA-regulated foods, drugs, cosmetics, medical devices, radiological, health, and tobacco products being imported or offered for import into the United States meet the same requirements of the Food, Drug, and Cosmetic Act as domestic products, and for preventing products from entering the country if they are not in compliance. The discharge of this responsibility involves close coordination and cooperation between FDA headquarters and field inspectional personnel and the U.S. Customs and Border Protection. This collection of information is being used by FDA to review and prevent imported products from entering the United States if the products do not meet the same requirements of the FD&C Act as do domestic products. Until October 1995, importers were required to file manual entry on OMB-approved forms, which were accompanied by related documents. Information provided by these forms include information such as country of origin, name of the importing vessel, entry number signed by CBP, that is the Customs and Border Protection, port of entry, port of lading and unlading, value in U.S. dollars, shipper or manufacturer, importer of record, original consignor, that's I'm sure I'm pronouncing that wrong, CONSIGNEE, broker, broker's reference number, and Custom and Border Protection house box number, bill of lading numbers, and location of goods. FDA stopped using these paper forms effective October 1st, 1995, to eliminate duplication of information and to reduce paperwork burden both on the import community and FDA. The agency then developed and implemented an automated nationwide entry processing system, which enabled FDA to more efficiently obtain and process the information it requires to fulfill its regulatory responsibility. Most of the information FDA requires to carry out its regulatory responsibilities under Section 801 of the FD&C Act is already provided electronically by flyers to CBP. Because CBP relays this data to FDA using an electronic interface, the majority of data submitted by the entry filer need be done only once. FDA estimates that there will be no additional cost to provide import data electronically to FDA, as filers already have equipment and software in place to enable them to provide data to CBP via the automated system. Therefore, no additional software or hardware need be developed or purchased to enable filers to file the FDA data elements at the same time they file entries electronically with the CBP. So what's going on here is this regards like Eton products, Schmuck products, Kanger products, Joytech products, Wismic products, which is basically Joytech, Aspire, any of that. They have to go through an actual process, a paperwork process, in order to get their goods into America or into the United States. And I'm going to get to it a little bit more as I go along, but they actually have, through the FDA final rule, because all this is directly comes out of the Tobacco Control Act and the FDA final rule, they actually have this new process that I will speak to in a little while here that will make it supposedly even easier for these importers as well as domestic manufacturers to go through. So I just wanted to, in other words, the foreign importers are also definitely not off the hook. In order to, let alone going through the PMTA process or the SE process or the pre-market SE process or the registration process or the certification process, they still have to go through the Customs and Border Protection process as well, and that's a whole different ballgame outside of what the FDA requires as far as the application process. So it's much wider as far as the processes are concerned. So I just wanted to speak to that. That's foreign importers. Now this is USA exporters. This is if a manufacturer or a distributor or retailer in America wants to export goods to another country outside of America. And this is where this is at. USA exporters. Section 801E 1 requires exporters to keep records demonstrating that the exported product meets with the foreign purchaser's specifications, does not conflict with the laws of the foreign country, is labeled on the outside of the shipping package that is intended for export, and is not sold or offered for sale in the United States. These criteria also could be met by maintaining other documentation, such as letters from a foreign government agency or notarized certifications from a responsible company official in the United States, stating the exported product does not conflict with the laws of the foreign country. So, under the FDA final rule, which this comes out of the FDA final rule as well as the Tobacco Control Act of 2009, that the exporter, like I said, manufacturer, distributor, retailer, whatever, or any business person in America that wants to export their goods, they also have to get permission by the foreign country to export those products. And once again, they have to go through a whole process of doing so. So that's the USA exporters. Now this is the PMTA requirements. Now this comes out of the FDA final rule as well. PMTA requirements at the pre-market tobacco application process. PMTA requirements. Section 910B of the FD&C Act states that a PMTA shall contain full reports of all investigations of health risks, a full statement of all components, ingredients, additives, and properties, and of the principle or principles of operation of such tobacco product, a full description of methods of manufacturing and processing, which includes a listing of all manufacturing, packaging, and control sites for the product, an explanation of how the product complies with applicable tobacco product standards, samples of the product and its components, and labeling. FDA is required to deny a PMTA and issue an order that the product may not be introduced or delivered for introduction into interstate commerce under Section 910C1AII of the FD&C Act if FDA finds that the manufacturer has not shown that the product is appropriate for the protection of the public health, the manufacturing, processing, or packing methods, facilities, or controls do not conform to good manufacturing practices issued under Section 906E of the FD&C Act. The labeling is false or misleading in any particular, or the manufacturer has not shown that the product complies with any tobacco product standard in effect under Section 907 of the FD&C Act. We are clarifying here that a PMTA may require one or more types of studies, including chemical analysis, non-clinical studies, and clinical studies. FDA expects that chemical and design parameter analysis would include the testing of applicable HPHCs, and non-clinical analysis would include literature synthesis, and as appropriate, some combination of in vitro or in vivo studies and computational analysis. For the clinical study component, one or more types of studies may be included to address as needed perception, use pattern, or health impact. It is possible that an applicant may not need to conduct any new non-clinical or clinical studies. We note that for most applications, FDA does not expect that applicants will include randomized clinical trials like those conducted to support drug and device approvals. For tobacco products already on the market at the time of the final rule, much of the information required to support a PMTA may be obtained from previously published research on similar products. Therefore, FDA expects that a large portion of applications may be reviewed with no or minimal new non-clinical or clinical studies being conducted to support an application. In contrast, The non-clinical and clinical studies may be required for market authorization of a new product for which there is limited understanding of its potential impact on the on the public health. The range of hours involved to compile these two types of applications would be quite variable. Now, and that mainly has to do with the master file, and I will actually get into that when I read the FDA final rule. Those that submit their applications, let's say in 2016 or 2017, if there's not any submissions that were approved already by the FDA, then the process will be very, very arduous. Hopefully I pronounce that right. ARDUOUS. It'll be very difficult because there's no products that have been approved. You understand? Like if they submit if they submit the Coupar Mini 60 watt with a Kanger Subtank Mini in the early part of 2017, and there haven't been any applications approved for these type of products, then it will be much more extensive, much more difficult process for the FDA to process. On the other hand, if this has been approved of, these two products here have been approved of by the FDA, then when the next person or company or manufacturer or whatever have you submits an application, it'll be much easier to get it processed because, like maybe you could say like a Kanger Subtank Mini is similar to something like a, similar to like an Aspire Nautilus to a degree. The ohms are much different. Like in Aspire Nautilus, the ohms are much higher, whereas in this is a sub-ohm tank, but it's somewhat similar. It operates pretty much similar to basic things except for the ohm reading, but it's similar to this tank. So the next person that submits an application, it will have a little easier time to go through. But unfortunately, they still have to submit all the PMTA paperwork. But it probably will have a better chance of being approved by the FDA because the other product was approved already, meaning this here, as opposed to an Aspire Nautilus. So, but then again, and I'll speak to it in the FDA final rule, it takes time for the FDA to actually process all this. Though they are, by statute, required to operate within a certain time frame, and that is 180 days. They have 6 months to actually approve. Once a application, and I'm going to speak about all this in the FDA final rule, but I'll say this much. Once once a manufacturer submits an application to the FDA and they receive it, when the FDA receives it through either electronic submissions, like I'm going to speak to in a moment, or it could be certified or registered mail. I would definitely certify and register it. I wouldn't just send it to them because you don't know when exactly they will receive it. And as soon as they receive it, that is when the FDA has up to 180 days to approve that application. There is a little leeway in there. They can extend it, but according to the statute, they can't extend it very long. Typically, they have 180 days once they receive an application to approve it within 6 months. That's according to statute. But I'll get into that when I do the FDA final rule. So this whole PMTA process is, like I read here, I mean, it's incredible. Like components, ingredients, additives, and properties, and of the principle or principles of operation of such tobacco product. A full description of methods of manufacturing and processing, which includes a list of all manufacturing, packaging, and control sites for the product. An explanation of how the product compiles with applicable tobacco product standards. Samples of the product and its components and labeling. And this is just some of it that they have to submit to the FDA. Huge, huge, complex applications. Anyway, that is the PMTA requirements, and that's in the FDA final rule. Now, this is a little long, but let's see if I can. I'm not going to speak to it completely, but I'm going to speak to it a little bit. And I speak to it a little bit more in the FDA final rule, but I just want to touch on it. And this is modified risk tobacco products. It comes under 21 U.S. Code, or United States Code, which is Acts of Congress. So 21 United States Code 387K. D. Following. Any person may file with the Secretary an application for a modified risk tobacco product. Such application shall include 1. A description of the proposed product and any proposed advertising and labeling. 2. The conditions for using the product. 3. The formulation of the product. 4. Sample product labels and labeling. 5. All documents including underlying scientific information relating to research findings conducted, supported, or possessed by the tobacco product manufacturer relating to the effect of the product on tobacco-related diseases and health-related conditions, including information both favorable and unfavorable to the ability of the product to reduce risk or exposure and relating to human health. 6. Data and information on how consumers actually use the tobacco product. And 7. Such other information as the Secretary may require. And that's, it really goes on, but I don't want to take too much time reading this. And I will include all this stuff in a separate video. I'm going to actually upload everything that I read, all my notes and everything will be a separate video outside of this whole project. So you can watch it on your TV set and pause it and read, things of that nature. But anyway, so what this is the modified risk tobacco products. And what that means is, let's say someone says that that if you vape, and where it comes from, actually, and I read about that in the litigation, in the past and present litigation part 1. It was in the Sottera case, Sottera, Enjoy case. And what was going on there was this modified risk tobacco products. And that is, at that time, was about actual analog cigarettes in that particular court case. And they were saying that, what tobacco companies were doing was they were putting down light, ultra light, low tar, things of that nature. And they were unable to do that, the court found. It ruled against against the tobacco companies, tobacco product companies. So, same thing with e-liquid. You can't say that this e-liquid here, or actually I'll use this e-liquid, like this Lightning Vapes Raspberry Rain. You can't say that this is less harmful than analog cigarettes, unless you, like what I just read off, unless you can prove that it is. And the chances of you proving that it is practically nil. It would take a very long time to do it, for one thing. And what's really very difficult to prove is, like it says, this is all documents including underlying scientific information relating to research findings conducted, supported, or possessed by the tobacco product manufacturer relating to the effect of the product on tobacco-related diseases and health-related conditions, including information both favorable and unfavorable to the ability of the product to reduce risk or exposure relating to human health. Now, there have been studies out there that state that it's that e-liquid is much less harmful than analog tobacco products. But they have to prove to the FDA that in and of itself, that e-liquid itself is able to claim that it's healthier or less harmful than not only analog cigarettes, but that it actually benefits the public health in general. Now, that's very difficult to prove. And to do those kinds of statistical analysis, and they speak about what I'm about to say here in a moment, they speak about this in the FDA final rule. It's called population assessment. And that is what they have to do is they have to do these studies on the general population throughout America to get a cross-border population assessment of all the states, of all the different people that live in different states, because they also have and this also is included in the FDA final rule, it's called an environmental impact study. So let's say, for instance, go to California, their pollution in California is probably much higher than if you go to, I don't know, Montana, where they don't have so many factories. Probably the air in Montana is much cleaner than the air in California, even though Californians have been, in the last 20 years especially, have been trying to, through the EPA and everything, I've been trying to clean up their act. But still, the air, the oxygen level within the air in California is a bit dirtier than the air or the oxygen levels in Montana. Okay? Now, this is what the FDA is asking for, okay, in the population assessment or the environmental impact study. Okay, just bear with me. So, which is insane what they're asking for, because it's not possible to do this type of study. So, what they're saying is a vapor, this e-liquid, here, for instance, a vapor that's in Montana vapes his device in e-liquid. Now, this vapor that just came out affects the oxygen/air levels within in Montana. Okay? Now, then he vapes again. And that vapor in California is much different because of the pollution and other many types of chemicals in the air in California is much different than the chemicals or the air or the oxygen that's in Montana. And how does that vapor affect the air in Montana as opposed to the air in California? This is what the FDA is asking for. Because what they're trying to say is, what the long-term goal is, anyway, is that like secondhand smoke, like analog cigarettes, secondhand smoke. If people have more secondhand, I'll just use this as an example, which has absolutely nothing to do with vapor. But let's say this is what they're asking for, because they're basing it on tobacco, really, okay? On the leaf, not the nicotine, but on the leaf itself, the combusted part of the leaf. So the person that smokes cigarettes, analog cigarettes in California, because the air is dirtier than in Montana, it's going to affect other people or other people within the environment around that particular smoker much differently than it will affect someone smoking an analog cigarette in Montana. And that the theory is that if you're in California, having all kinds of analog smokers smoking at one time, the secondhand smoke will affect the population, the general population, in a detrimental way, more so than in Montana, because the air is cleaner. It's not as dirty because of, and therefore the chances of that secondhand smoke being breathed in by the general population is less so than California, if you understand. Hopefully you get it. And what the vaping industry would have to do is prove to the FDA that vaping in California is less harmful when you vape, you know. That vapor is less harmful in California as well as in Montana, and it doesn't affect the general population in any detrimental way. Now, how do you prove a study like that? That's what they're asking for as far as population, and I'll get into that with the FDA final rule. How do you prove that with the population assessment as well as environmental impact study? How is that possible? It's absolutely insane. It makes absolutely no sense. It's not even possible. To do a study like that, you would have to have so many types of analysts and so much data on different levels that it'll take you 10 years to figure all that out, if you even do figure all that out. And this is what they're asking for in this here, right here. And the effect of the product on tobacco-related diseases and health-related conditions. How does that product, meaning that vapor that I just vaped, how does that vapor affect others in the population or the human health? Like it says to the ability of the product to reduce risk or exposure is the key word in that. How does this vapor that comes out of the tank and that exposure to the general population, how does it affect them in variable ways in regards to tobacco-related diseases or health-related conditions, as opposed to Montana versus California? It's impossible. It's impossible to do modified risk tobacco claims. You can't do that. It's impossible. And this is the reason why the tobacco companies, the analog cigarettes, lost in that case as far as the modified risk tobacco product claim. And the vaping industry will lose as well because it's impossible to find that kind of scientific substantial data. It's impossible to do those studies. You'll never reach a conclusion. There are just too many variables. Too many. It's impossible. I don't even think Albert Einstein can figure that one out. So anyway, that's the modified risk tobacco product or claim. Now this goes on for a while, but I'm not going to do too much of it. But this is FDA final rule definitions. And I'm just going to do just a little bit of it because it's 19 pages long. But I'm just going to speak to the definitions and not get into purpose and definitions and all this other stuff that goes along with the entire part. And this is also in the FDA final rule as well as in the Tobacco Control Act of 2009. So anyway, I'll just speak a little bit to it. FDA final rule definitions 1100.3 definitions. For the purposes of this part, accessory means any product that is intended or reasonably expected to be used with or for the human consumption of a tobacco product, does not contain tobacco, and is not made or derived from tobacco, and meets either of the following. 1. Is not intended or reasonably expected to affect or alter the performance, composition, constituents, or characteristics of a tobacco product. Or 2. Is intended or reasonably expected to affect or maintain the performance, composition, constituents, or characteristics of a tobacco product, but I. Solely controls moisture and or temperature of a stored tobacco product, or II. Solely provides an external heat source to initiate but not maintain combustion of a tobacco product, component, or part means any software assembly of materials intended or reasonably expected 1. To alter or affect the tobacco product's performance, composition, constituents, or characteristics, or 2, to be used with or for the human consumption of a tobacco product, component or part, excludes anything that is an accessory of a tobacco product. Package or packaging means a pack, box, carton, or container of any kind, or, if no other container, any wrapping, including cellophane, in which a tobacco product is offered for sale, sold, or otherwise distributed to consumers. Tobacco product, as stated in Section 201 RR of the Federal Food, Drug, and Cosmetic Act, in relevant part, a tobacco product. 1 means any product made or derived from tobacco that is intended for human consumption, including any component, part, or accessory of tobacco products, except for raw materials other than tobacco, used in manufacturing a component, part, or accessory of a tobacco product. And 2 does not mean an article that is a drug under Section 201G1 of the Federal Food, Drug, and Cosmetic Act, a device under Section 201H of the Federal Food, Drug, and Cosmetic Act, or a combination product described in Section 503G of the Federal Food, Drug, and Cosmetic Act. So that's pretty much it there. And just one little other thing, 1140.2 purpose. The purpose of this part is to establish restrictions on the sale, distribution, and use of cigarettes, smokeless tobacco, and covered tobacco products in order to reduce the number of kids and adolescents who use these products and to reduce the life-threatening consequences associated with tobacco use. So, that is basic. I mean, there's many other definitions, and it goes on for a while. I mean, there's 19 pages here just on definitions. But what it basically says is accessories like lanyards and what is it? It's lanyards and there was something else. Lanyards and screwdrivers or accessories, according to the FDA, because what it is affect or alter the performance, composition, constituents, or characteristics of a tobacco product. So therefore, a lanyard, that you attach to your device or your vapor pen to put the lanyard, maybe hold it around your neck or hanging from your pants or whatever, buckle or whatever, doesn't affect the performance or the composition of the e-liquid. A screwdriver, well, anyone can get a screwdriver. It doesn't actually, it doesn't affect the performance of anything on this device here. Except if you have a cherry bomber. Apparently FDA doesn't know that much, apparently. On the cherry bomber, the original cherry bomber, if you put a screwdriver between the I think it's the RDA and the box itself, it'll actually short. And in a sense, it does affect the performance. But let's not tell the FDA that, unless they watch my videos, because they'll be including that next, screwdrivers. But anyway, but everything else does affect the performance according to the FDA, like this Crepor 60-watt mini. The electronics in here affects the 510 positive pin, which is connected to the coil, then is connected to the wiring, which is connected to the cotton, and therefore it affects the performance of the e-liquid. And therefore they call it co-packaging, that everything works together, as well as the intended use. And not only that, then the tank is attached to the drip tip. So therefore everything on this particular device, RDA and tank and variable wattage device, including the drip tip, can be regulated by the FDA, because everything affects the performance of the entire, including the screen that lights up, everything that can affect the performance of the overall production of vapor. That's the FDA reasoning anyway. But so that's what those basic definitions are. All right, and now I'm not going to get too much into this because this is a very long thing. One second here. If it'll open up. 1 second. No, don't want that. 1 second here. One second. Let me just look at something real quick. No. Okay. So, actually that went a little shorter than I thought it was going to be. And, well, 1 second here. 1 second. Give me 1 second here. As I wanted to speak to something else, actually. See if I can find it here. Okay, here we go. I knew there was something else. All right. So this is the actual electronic submissions. And this is from the FDA final rule. Let me make it a little larger. So electronic submissions. FDA issued guidance documents on both 1. Registration and product listing for owners and operators of domestic tobacco product establishments, 7.4 Federal Register 58298, November 12, 2009, and 2. Listing of ingredients in tobacco products, 7.4 Federal Register 62795, December 1st, 2009. To assist persons making these submissions to FDA under the FDA's Food and Drug and Cosmetic Act. Although electronic submission of registration, product listing, and ingredient listing information are not required, FDA strongly encourages electronic submission to facilitate efficiency and timeliness of data management and collection. To that end, FDA designed the e-submitter application and then the FDA FURLS to streamline the data entry process for registration, product listing, and ingredient listing. This tool allows for importation of large quantities of structured data, attachments of files, that is, in PDFs and certain media files, and automatic acknowledgement of FDA's receipt of submissions. FDA also developed paper forms, Form FDA 3741, registration listing for owners and operators of domestic tobacco product establishments, and Form FDA 3742, listing of ingredients in tobacco products, as alternative submission tools. Both the FURLS and the paper forms can be accessed at http://www.fda.gov/TOBACCO. So, what the FDA has done since with the FDA final rule is that instead of submitting all that in the U.S. mail, you can actually electronically submit it to the FDA, which, according to them, is supposed to be more streamlined and be a little easier process. Now, I spoke about this before in another part of this project here, and that is, remember the Affordable Care Act, Obamacare, and people were all trying to submit at once all their medical papers or doing the applications online, and the entire website crashed, and not only crashed one time, it crashed many times. Well, I'm sure that if vaping manufacturers start to submit these applications and they come to the FDA through the electronic submission process. Eventually, it's going to crash or have a lot of problems and all this other crap, and that'll be the FDA's way of saying, oh, well, we have to put a little delay on this. Now we have to retool and everything. Who knows, I mean, I don't trust the FDA anyway, let alone electronically submitting your products. But, the only problem with that is that you also have to submit samples of your product. So if you're submitting a tank or a variable wattage device or an e-liquid bottle, it would be very difficult to submit that electronically unless you have a 3D printer, and even that, it's not going to work because you have to actually submit this e-liquid itself. So I'm sure all that stuff has to go through the U.S. mail. Of course, the FDA did not address that at all in the FDA final rule. But I'm telling the FDA right now that this electronic submission process only works for certain things. Apparently, you didn't think of everything. So anyway, this is part 6, I believe. Part 6 of the FDA final rule electronic submissions. And you got a pretty good idea of what it's all about, the penalties that are involved if you don't make the submissions to the FDA and they don't receive it and approve of the applications, as opposed to all the definitions and understanding what they expect in these particular applications. And I'll definitely get into all that with the FDA final rule. And but you get a general idea of what's going on as far as these electronic submissions of these applications. And now I'm going to do my next part. And you guys have a good one. Bye.